Hi, my name is Yelena Ristic, and this is my YouTube channel, Prolotherapy and Perspective. Thanks for joining me today. If it's your first video that you're seeing, there are several more before this one on the playlist that you should probably take a look at. There's a lot of good information there. And just to introduce myself a little bit more and what I'm doing with this channel, I've been undergoing prolotherapy for about 8 years now. I've seen just about everything. I went from a certain type of prolotherapy, ill-administered, disabling me, to the correct type of prolotherapy, basically miraculously fixing me to the point where I can dance again when I had been previously told that the disability that I had been put in it was non-reversible and I would never walk again, let alone dance again, and let alone live a normal life. So quick little disclaimer, I am not a doctor. This isn't supposed to be taken as medical advice. I'm simply sharing my experiences in my journey, which was quite vast with many false starts, errors painted into, what seemed like impossible corners that I had to get out of. So I thought I would share it in case it would be useful to any of you who are in chronic pain, injured, considering prolotherapy, or have tried prolotherapy and it didn't go well and you're wondering if you should try again with someone else with a different solution and what you might be able to do. So prolotherapy is generally a simple procedure. However, there are so many different ways of administering it and so many different factors around it that can influence your healing or lack of healing, that I'll be covering as many of those as I possibly can, as many as you would like me to. As well, I'm open to all of your suggestions in this video series on this channel. With that said, it would be fantastic if you have any questions or comments or feedback for me to put them in the comments below this video. However, if you want to interact with me in a more private or personal way, you can email me at my new email address. That's prolotherapyandperspective@gmail.com. You'll also find it for your reference below. So let's get into the topic today. When it comes to activity and prolotherapy, to cut to the chase, obviously, the more active you are, the healthier you are. The more activity you do, the more circulation you get to all the areas of your body. Ligaments and tendons, especially if they are injured, very poor blood flow. Logically, you'd want to get as much blood flow in there to help healing. And this all makes perfect sense, theoretically. Practically, it has been my experience that there is a big issue around how much injury you have, the type of injury you have, what area is injured, and what kind of activity you're prescribed. Now, I wasn't, and I'm assuming neither are you. You may be, but I'm assuming you probably are not a physiotherapist. And even as a physiotherapist, you may not have dealt with multi-layered, multifaceted injuries that a lot of chronic pain patients have, and it's hard to figure out what exercises to prescribe to, on one hand, not harm the patient, and on the other hand, help the patient improve and heal and gain strength. And it is difficult. It's very difficult. So in terms of my own experience, I was initially quite severely injured when I went for my first prolotherapy sessions, and my mindset was basically hysterical. Like, I have to do everything in my power to make sure that this works. I can't leave a single thing out. I'm going to supplement, I'm going to do the physio, I'm going to do whatever it takes to get better and get back to dancing. And although that sounds admirable and very committed, it was also a bit of a mistake because I was willing to do everything and anything it took, but I didn't have enough knowledge to understand what might actually be very harmful. And one of the things that I 100% believe also caused my initial prolotherapy treatments to fail. One of the factors, there were several, but one of them was physiotherapy and the wrong kind of physiotherapy prescribed. For the injury, and just in general for the prolotherapy that I was having. And I would suggest, if hindsight being 2020, if it's at all possible, I would suggest doing nothing more than very light everyday activity if you can. If you're already, before you go for your prolotherapy treatment, if you're already able to walk around, able to do fairly normal activities fairly well, I would say continue to do those, but scale them back a little bit, at least a little bit, to where you're not provoking any pain. During the first at least 2 to probably 6 to 8 weeks, if not 12 weeks after your treatment, to allow those structures to heal. And I'll tell you why. When a tendon or a ligament or any structure is injured, the muscles around it, the area around it, you're going to have some hypertrophy. So if, let's say, a certain joint is injured, the muscles around it are going to become weaker and are going to want to protect that joint by not working as much or as hard. They're going to shrink, and they won't be as strong. So that's kind of nature's way of telling you, please don't use this, it's damaged, or use it far less. As soon as a little bit of discomfort and pain is provoked, it should alert you to stop doing what you're doing. The reason for that is your body is now out of balance. You don't have the correct structure of musculature supporting that joint the way it should be supported to go through a full range of motion properly, to bear weight properly, to change directions and bear weight without being exposed to injury. So if you continue to do something that is painful over and over on that joint, and especially after prolotherapy treatment, what will end up happening is you'll get a repetitive strain injury, or you might even get a collateral injury while the first one is healing. It's a very sensitive situation. So let's divide the injuries up a little bit into different examples. Let's say you have just one ligament or tendon that is slightly torn. It's causing you some discomfort and pain. You want prolotherapy to get it fixed. You've gotten your prolotherapy. Should you or shouldn't you do physiotherapy? I would suggest probably, yeah, you should. It would help because the amount of muscle imbalance you're going to have is going to be very, very small. And I know that there is a kind of saying around physio, no pain, no gain, not to an exaggerated degree, but you're supposed to expect some pain and soreness with physiotherapy. I would shy away from that. If you do as much activity as you can, and when you start to feel tension, discomfort, back off. And you can try and do it again the next day. What that tension or discomfort or pain is trying to tell you is that your muscles are not functioning properly around that joint. They are, when they're being worked, in a state of dysfunction, which is causing them to be tense and uncomfortable, which means if you keep pushing, the unequal now forces that are being exerted on that joint due to injury are going to start tearing away at things that are already damaged or things that aren't yet damaged and potentially cause more damage. So with a small injury, I might entertain physiotherapy. Personally, given the experience that I've gone through, I actually wouldn't do any. I would wait to go to my prolotherapist, have a checkup ultrasound, and when I'm in no pain, I feel great doing everyday activities. I don't have any evidence of pain, and he can tell me nothing's torn anymore, it's fine. Then I would start doing physiotherapy or increasing my exercise or level of activity. Because why? If it's a small injury, it'll probably be healed 6 to 8 weeks, maybe at the outside 12 weeks. The tissue will be fully there and repaired, and that's the time to start strengthening the matrix slowly, incrementally, and you should be fine. If you do it sooner than 6 to 8 weeks, you're risking re-injuring the area. You're risking that maybe your prolotherapist or diagnostician missed some other kind of injury. You might exacerbate that and not be sure if your prolotherapy worked. It's just adding more unnecessary variables. So if you have a small injury, I would rest it. I don't think there's anything wrong with that. Once it is visibly healed on ultrasound or other imaging and you feel no pain, then go ahead and start increasing your activities. That's a kind of ideal situation. Now let's say you're moderately injured. There are some muscles, ligaments, tendons in the same area that are moderately injured, but you want to keep your heart rate up and keep your level of activity up. So let's go through what really is essential to healing. I'm assuming with a small injury, you're doing your everyday activities, you're active, you're walking around, you're walking as much as you can before you feel any pain, so your circulation is going to be maybe not fantastic, but quite good, decent, and it will support your prolotherapy enough. Now, often people are prescribed the most physiotherapy when they start to become seriously dysfunctional due to their injury to try to regain function. So let's talk about what is often recommended, types of activity. I'm just reading here to make sure that I don't miss anything. So cardiovascular exercises, often to get blood to the area. Increase your heart rate, increase blood flow. Excellent suggestion. However, you don't want to do something that is going to be affecting or potentially putting your now treated injury in a situation where it could be re-injured, or you could mess up your prolotherapy treatment because you've done too much activity and just you're then not 100% sure, was it the physio, did my prolotherapy not work, and then you're not sure which one it is. So what I would recommend, and I will do this in another video, are cardiovascular exercises that do not incorporate the joint or the area or the injury whatsoever. So for example, if something on your legs is hurt, if your ankle is hurt, one simple example, lie down on your back and do bicycle exercises. Don't put any strain on that. Don't do, obviously, squat, something where you have to be on your feet where your ankle is supporting weight, but sit in a chair and do chair exercises any way that you can so that there is no pressure on your ankle. If it's a hip, that's harder, but you might be able to use from the knees down just to move around, get some blood flow. You could use your arms, do a cardiovascular exercise or routine that uses your arms to get your blood flow going, or your upper body, and that will help some. There are also breathing exercises, but I'll go into types of exercises and guided exercises in other videos, but that's just an example, kind of a logical example. Balance exercises. I am not a fan of these. The recommendation is that when you have a weak or damaged ligament or tendon, the perception of your limbs becomes distorted, which it does. You actually, in my experience, even though my leg was fairly straight, I felt like it was twisted inside my hip, and I also felt like if I were to look down at my foot, it would be, instead of sitting like this, like twisted in like this, is what it felt like, but it wasn't. It was sitting straight. It was because there was some nerve damage. The muscles were imbalanced, and I had this proprioceptive perception that things were more badly placed. They were a little bit out of place. Clearly, if you have injury, it changes the position of your joints slightly. And if you have muscle weakness, it can also, make you more flexible, which does change the position of your joints. But in my perception, I felt like things were far more wonky, to use a technical term, than they actually were. So balance. Again, balance takes a lot of fine muscle firing and motion and adjustment and compensation. And if your muscles are already compensating, you're putting extra stress on the muscles that are working. They can't exert forces on the joint that's damaged the proper way because there are other muscles that are supposed to also be exerting force, and they aren't at a relative value in a relative way, and they're very dangerous because you could lose balance and tug on too many areas at once. balancing is not in isolation. Balancing uses a whole constellation of muscles at the same time, and you could I personally got really badly injured trying to do balancing exercises. They don't necessarily hurt because so many muscles are compensating at the same time, but they can exhaust your muscles, and then you go and do something else, and that's when you get hurt. So my personal experience is avoid balancing. You can balance later, which I definitely could. So I can give you an example. I could not do the test where you stand straight. I'm not going to use the technical term. You may or may not understand it. You stand straight up. You stand on both feet. And then you transfer your weight to one foot and try to balance while making sure. So if these are my hips, right? They're supposed to be level when I'm standing. Then when I go to say lift my this leg, if I lift my right leg up, all right, what should happen is I should be able to lift my hip up with it without a problem. I could sort of not move my torso, the whole torso, just move my hip up into my body easily and balance on the leg and keep this hip slightly raised. Now, I couldn't do that on my left side. My left side was injured. There was no way I could raise that hip. So this was really a problem for me. It was impossible for me to do, in fact. I couldn't get my hip up at all. And I had several prolotherapy treatments before I could do that. I had been misdiagnosed with a labral tear, meaning nobody knew I had a labral tear, and they were assuming this was because I had a pinched nerve and I didn't have enough muscle strength to lift the hip, etc., etc. I was given balancing exercises, not knowing that I had a compromised hip joint. The vacuum seal was broken in the joint due to the labral tear, and that balancing was actually the worst thing for me. So after several prolotherapy treatments, I slowly tried myself. And again, I went from absolutely almost not even at my worst state, not even being able to get my right foot off the ground. It's the left that was damaged, the left hip that was damaged, so it was supposed to bear the weight and be able to balance. I couldn't balance, I couldn't bear weight, I couldn't do anything. I was just absolutely unable to lift my right foot off the ground without supporting myself on something else. No physiotherapy whatsoever, no balance exercises whatsoever, but enough prolotherapy to completely seal the labral tear, allow the muscles around to relax and also spontaneously heal, treatment to the tendons and muscles around the hip joint that were also damaged. I didn't do anything for about a year and a half or 2 years. I needed several treatments. And then magically, I could suddenly just stand on my left leg and lift my right hip in the air and hold it there for as long as I liked. So that was with no physio, because the problems that were affecting my balance were solved, and then my balance came back. But if the problems that are affecting your balance are still there and dramatic enough, trying to force yourself to balance is only most likely going to cause more injury. I can't see how you can fix a balance problem when the cause of the balance problem is not addressed. Most like any problem, if you have causes to the problem, the best way to fix the problem is to address the causes and not come up with a band-aid solution. Resistance exercises, they're amazing for everything. With ligaments, it's not advised, okay? It's not advised unless it's very, very, very light and you need some distance between your prolotherapy treatment and your exercise. Most doctors have recommended to me 2 or 3 weeks. I have never really found, maybe I'm a slow healer, but I have never really found significant enough healing happening for me until a minimum of 8 weeks out to 12 weeks out. Now again, I had several things treated at the same time and pretty dramatic injuries. So maybe that's why in my case, because it wasn't just one ligament or one tendon or a couple. I would have 6 or 7 or 8 structures. When I say structures, I don't mean different joints. I mean structures around my hip or in my lower back treated at the same time, sometimes a minimum of 7 or 8. So it took time for all of that healing to happen. My sweet spot was 12 weeks, so I wouldn't bear more weight than I already could at the time of the prolotherapy treatment or before the prolotherapy treatment until 12 weeks after, and that's when I would start seeing if I could bear a little bit more weight, experimenting with bearing more weight in resistance. Flexibility exercises. Okay, so in my experience as a dancer, I have found flexibility to be one of the easiest things to increase on a healthy body, definitely, with the proper exercises. Now, also having had as much experience with injury as I've had with dance, I can also say that areas become tight because they are guarding. And if you're saying, oh, I have no flexibility in this joint, and it happens to be your injured joint, my recommendation is leave it alone until it has healed. Once it is healed and you're getting more circulation in there with more movement and more activity, you might find that it becomes naturally on its own, spontaneously more flexible. If you need more range of motion and more flexibility, you can always engage in stretching and flexibility exercises after, again, you can see on an ultrasound that the structures are no longer compromised, they have healed, you're not in pain, it's not too late to do stretching exercises. So if you're one of these people like I was when I first got informed of everything I should do to make my prolotherapy treatment a success in generic terms and not specific to me, and you want to go out and do all the supplements and maximize your healing and therefore do all the correct activities, I'm going to tell you relax. Based on my own experience, relax. Healing, it's like picking at a scab, right? So if you have a scab on a finger, are you going to keep doing this and making it bleed and making the scab come off prematurely and then re-scab over and over and over again? Not really necessary. You could put a little splint on your knuckle, maybe where that scab is, wait a week or two. So when I say splint, you can leave the wound area open, but you don't move your finger. I'm talking ideally, so there's your finger. It doesn't move. Everything heals up. The scab falls off, and you can move your finger, and if it's a little tight, you can stretch it. So I know I'm simplifying, but it basically really does, in my experience, work along those lines. There was no way on earth I could sit cross-legged. There was no way on earth I could sit and extend my legs in front of me when I was my most injured. It was excruciating to try to sit cross-legged. I also could not sit on my heels, so bend my knees and put my butt on my heels. Absolutely impossible. With no physiotherapy and with healing, when my healing reached a point where it was about 85 to 90%, magically, I can sit cross-legged. I might have a tiny bit of stiffness, but all I have to do is stretch it out a little bit. I still have some injuries in that area. They're smallish. They need some treatment. But even with those injuries, I have the full range of motion. I just feel it a little bit in that hip. And when I say a little bit, I mean just a little bit. But the flexibility is there. There's no need for me to create it. Once I healed, it came back. If I wanted more, I could go ahead and do that. I don't particularly need more for what I'm doing. And also, I would highly recommend look at your life, especially if you're older. I am going to be 48 this year, so I have no illusions that I'm going to become a gymnast anytime soon. And I don't need to be one. So please don't fall into the trap of perfection. Like, to have a perfectly healthy body, it must be flexible and strong, and you have to have circulation, and etc., etc. This is ideal. I would love to remain that way until my 80s. But you also have to be realistic about priorities. What are the tasks that you need to be able to do on a daily basis to have a decent quality of life? So we know that quality of life dramatically goes down when you lose your job and you can't work. So what do you need to do for your work? Number one, what do you need to do to take care of yourself? Make your bed, wash the dishes, go grocery shopping, take a shower. What are these sort of basic physical requirements that are going to be on your body in order to be able to take care of yourself through work and personal maintenance and everyday life? When you isolate those, make those your first goals. Once you get to doing those, then you can expand. But don't try to, and you can also get bored. I would get super bored because I can't use my body and I desperately want to use my body. And I would think, oh, if I just, can do some squats every day, I would feel much better. I don't do squats. I'm a dancer. I don't squat. I'm back to dancing. I could squat to create strength, but I don't have to. Doing my dance routine slowly, deliberately, engaging all the muscles, being very careful, I build the strength I particularly need for what it is that I want to do, if that makes any sense. So don't fall into the trap of these are the exercises I absolutely must do in order to have a strong body. Figure out what you need your body for. Figure out what you want your quality of life to be, and figure out what level of activity you need to support that. So if you want to walk every day, you don't want to or you don't need to lift heavy things, then don't overdo it with resistance training. Go for a light walk if you can. Increase it. I used to walk around in my room, so I would pace back and forth in my room because I live in Canada. So treated hip, treated back, icy roads, freezing cold, not going out there, but I want to walk desperately. So I put on some music I like or a podcast I would like to listen to, set a timer so I don't forget or overdo it because maybe the day before I walk for 10 minutes. Now I don't want to go over even if I feel well. I want to control it. So that's what I would do. I would pace back and forth in my room while listening to a podcast or listening to music I like. Or I would decide I'm going to do the laundry, and maybe the laundry is way too heavy for me to carry. It was at that time I could carry almost nothing. So I would do it in bits. So I would take it, I was living in an apartment at the time, so from one side of the apartment to the other. So then I would walk and do laundry. Or I feel like doing the dishes today, I'll do the dishes. These are all activities. So it doesn't necessarily have to be framed as physiotherapy. Slowly get to doing the things that are going to make you feel independent and happy. Balance. So balance the pain control. This is what it says. Make sure to consult your osteopathic physician regarding adjustments to your other tissues such as muscles, fascia, skeleton, etc. in order to optimize healing properties. Okay, myofascial release, trigger point injections, manual adjustments. Again, these things definitely can be helpful, but if they're precisely undertaken by someone who's extremely knowledgeable and understands your condition. I had these adjunct therapies added to my prolotherapy journey at the beginning of the journey, thinking that these were necessary. My thought was, oh my God, I'm out, my muscles are in the wrong place, my joints are unaligned, how are they going to heal? I'm exerting stress on areas I shouldn't, or my muscles are tight, I'm not getting circulation. I need to get deep tissue massage, myofascial release, trigger point there, all of these things, and I thought this was so important. In my case, they did far more damage than good because it was too much, forcing my muscles to relax when they didn't want to because they were guarding an injured area. They would be forcibly relaxed, and then my neurology, my brain to nervous system to muscle and joint communication system would break down. because it's like, this is what you used to tell me to do before. Now I'm getting no information. These muscles are relaxed. They're too relaxed. They're offline. I don't know what to do. Okay, I'm going to engage a bunch of new muscles or different muscles, or all these muscles are relaxed. I don't know what to engage. Pain would go up. Dysfunction would go up. I'd open myself up to injury. A few times I got more injured, absolutely got more injured through a chiropractic treatment, even an osteopathic adjustment at certain points. Myofascial release, deep tissue massage used to make me break out into a 24-hour sweat where I had like muscle fever and I would just be sweating and shaking for 24 hours because I was so injured. So many areas were injured and I wasn't fully diagnosed at the time. So the therapist really didn't know what kind of a body they were working on. They were trying their best, and I'm not saying they did a bad job. It was just a terrible job for me. And I found even in that horrible state, I had knotted muscles, overdeveloped muscles, torn muscles. I was a disaster. It was like I'd been in a car accident or partially drawn and quartered at my worst. And it was at my worst that I decided I can't deal with all these variables. I can't do this anymore. I'm just getting prolotherapy, and what I never have done to this point in time is just gotten prolotherapy, lied down, rested, and waited for the healing to happen. I did engage in breathing exercises to make sure that I was oxygenated, but I didn't put any kind of physical stress on my body for the first year and a half that I got, that I met the final doctor who treated me and who is my doctor now, and the one who turned me around and got me from severe disability back to dancing again. When I met him, I made a deal with him. I said to him, there's no way on earth I'm doing physiotherapy, so if you're going to force me to, just forget it. I don't even want to be treated. Many doctors did force me or highly, highly recommend to me that I do physiotherapy. Otherwise, they couldn't guarantee healing and function. And this, my doctor now, he basically said, yeah, you can heal up and then do your physio later if you want, or we can talk about it later if you want. But once you're fully healed, if you're still having trouble and dysfunction, then we can look at physiotherapy. So he allowed me to take control of that. Being a super active person, I was so excited anytime I could get a little bit more activity in safely. So my physiotherapy was simply just walking, going for mall walks. 12 weeks out of my first therapy, I decided to go for like a 10 or 15-minute mall walk. And when that went well, I would do that once a week, then twice a week, the same walk, then 3 times a week. And then when I could do it every day, I would keep increasing. I would have more therapies. I would scale back the activity for 12 weeks and then go back to where it was before that treatment, and then increase it, and then know at my next treatment, okay, here's my increased level of activity. Now I'm going to scale it back to here, which is actually this much more than one treatment ago. And I just did this 2 steps forward, 1 step back, 2 steps forward, 1 step back, 2 steps forward, 1 step back, until I increased my activity enough that I realized, wow, suddenly I can go to work. I can wear any shoes I want. I can walk all day. I can walk all day even on concrete. And there was nothing special that I did with severe injuries. So for those of you who maybe haven't watched previous videos, just a quick rundown, but you can watch previous videos to find out what my injuries exactly were. But it was in my entire lower back, especially my left SI joint was extremely loose. It just would not stay in place. My lumbar vertebra 3 to 5 were affected, the ligaments in that area. My hip had a labral tear in it. I had several torn muscles around my hip, and I also had like deep tears in psoas muscles and deep abdominals. So I was just a wreck, absolute wreck, on all kinds of pain medication. Probably, I think, counting 5 or 6 different types of medication, specifically gabapentin and tramadol to control pain. The others were muscle relaxants or anti-anxiety medications and antidepressants, because I had gotten in such a terrible psychological state. So I was on all of, they also kill pain. So I was on an enormous amount of pain-killing medication, and I got off of it without physiotherapy, just walking, moving around and walking, everyday things. So this is a bit of a long video today, my 35 minutes on activity. I will post my next videos. I will talk to you more specifically exactly about the exercises that I used, breathing exercises, some yogic breathing exercises. I'll give you some references as well as demonstrate some things for you to help keep your body very well oxygenated. That is the least that you can do, and also the most that you can do. It serves you an enormous amount. So you can work on your oxygenation. So take heart if you're in a state where it's your back or your hips or something that makes even walking a little bit excruciating or inadvisable. You can still do breathing exercises. You can still move your arms around. And I'm hoping that this video might clear up for some of you why perhaps some of your prolotherapy treatments didn't work or didn't work as well as they could have. If you were prescribed physiotherapy that caused you to overdo it, that could be the cause of your prolotherapy treatment not being either as effective or effective at all. Again, you would need to consult with a doctor. This is not medical advice, but in my experience, doing no activity and waiting for my structures to heal via prolotherapy has never done me any harm. It's actually done me the most good. So that's the video for today. I'll be making, again, I'm hoping back to once a week. For those of you who've been watching, you knew I was off for almost 3 weeks. I apologize. I have a new job, but I'm settled in. Things are, scheduling-wise, are much better. So please do subscribe so you'll be notified when you get the new video. And don't forget, please leave me a comment. I love reading the comments. If you have a question that you don't mind posing publicly, other people can benefit. If you would like to speak to me privately, please use the email that's listed below, prolotherapyinperspective@gmail.com, and I'll make sure to check that and get back to you. I wish you all the very best in your healing journey, and I hope you'll join me again soon. Take care. Bye-bye.